towards opening into the nasal cavity. So there's a nasolacrimal duct blockage on the right side. Then this CT-DCG scans can be incorporated into the navigation system, where you can localize the lacrimal sac in the 3 different planes and even in 3D reconstructed orbits. So this patient, if you see on the right side carefully, the maxilla is missing and only the lacrimal sac is present. The nasolacrimal duct has been removed along with the maxilla. So this is a patient of CA maxilla in which total maxillectomy had been performed. So navigation can be useful in such kind of complex NLDOs. And if we look endoscopically at this patient, you see the scar from the previous surgery, and this is the nasal cavity. And down below you can actually see the endotracheal tube. So there's no compartmentalization between the nasal cavity and the oral cavity in this patient. So this is a short video that is going to show how CT-DCG can be incorporated into the navigation system. Here the lacrimal system has been color coded after the CT-DCG scan. And you can move around and you can see the structures in 3D view from any point of either from the left side, from the right side, inferior, superior. So it gives you a better idea of the pathology that you are dealing with. So on the right side we're seeing the sac is red, but there's no NLD. So this is a complete 360-degree maneuver that is being done to see the sac at different angles. And now you can see in the 4th image where the probe is touching the lacrimal sac. In the corresponding images, in the corresponding scans on the axial, coronal, sagittal, you can see the crosshairs, the vertical and the horizontal green lines, they are also located at the sac. So it gives you the idea that you are touching the sac. And now this is the endoscopic view of the same, where the metal probe is going and touching the lacrimal sac, and then in the 3 different planes you can actually localize the sac. And these are the different axial views at different distances from the lacrimal sac. And then again, after you have opened the sac, you can again confirm. So this is how 3D DCG can be incorporated for stereotactic surgery into the navigation system. And for those who are interested, this is the original publication of the same. Then this is the case number 2. This is a very rare anomaly. This is congenital arrhythmia microphthalmia syndrome. And here you can see the left side of the face is not fully developed. And if you look at the nares, the nose of the patient, it is also not fully developed. So when you look endoscopically into this patient's nostril, you can see on the right side, that's the right nasal cavity. In between is the septum. And then on the left side, the nasal cavity is not well developed. And the largest structure you see on this side is the concabulosa. That's a large middle turbinate on the right side. So when we see the CT scan of this patient, you can actually see on the right side the nasal structures, the sinuses, but on the left side there's no maxillary sinus, there are no nasal structures seen. So this is a congenital arrhythmia. So now this patient we saw in the earlier image is Roplas positive. She has a nasolacrimal duct obstruction, wants correction. So how do we go about it? So navigation guidance was used to localize the lacrimal sac in this patient, and an intended pathway was created from the left lacrimal sac to the right nasal cavity, because there is no left nasal cavity. So now you have to create a pathway into the opposite side. This is the 3D view of the same intended pathway. So in the surgery, first of all, a turbinoplasty was done because we saw the turbinate was very large. Then secondly, a conventional endoscopic DCR is done to open up the sac. You can see the probe coming out of the left lacrimal sac. And then navigation was used to confirm if you've reached the septum. So the probe here is touching the nasal septum, and it can be confirmed in the 3 different planes. And then This is the flap created from the nasal septum. The flap that you're seeing on the screen is actually nasal septum flap, and the probe is touching the nasal septum flap. And this nasal septum flap was anastomosed with the lacrimal sac on the left side, and after anastomosis you can see the probe has now reached the right nasal cavity. This is intubation being done in the right nasal cavity from the left lacrimal sac. So for those interested, again, this is the original publication of this case. They can read it online. And this is another publication for those who are interested in this topic: image guided dacrylocalization in traumatic NLDOs. So to conclude, complex NLDOs are increasingly common now, and meticulous clinical examination and meticulous preoperative planning is needed for good management of these patients. Navigation guidance is a very helpful tool. In the surgeon's own brain, he has to remember the original anatomy, and from the scans the altered anatomy of the patient, and then incorporate that into the navigation system, which can lead to fruitful outcomes.